Hello and welcome to this episode of a Clean Bill of Wealth podcast. I'm your host, Galen Nuttall, and as always, this is the spot where I interview people who are up to amazing things, supporting and enhancing the lives of physicians, especially Canadian physicians. Now, I have a quick question before we hop on over to the episode. Have you ever wanted to work with a financial planner, pay them for their advice or a plan, but not have to buy a product from them? I got good news for you. I do that. It's called fee-based planning, where you pay for a plan that answers your top questions like, should I pay off debt or invest? Am I making the most of my corporation? How should I invest inside of my corporation? What do I need to do to be on track for retirement? And much, much more. If you want to know more and are wondering if you're a good fit for fee-based planning, head on over to galenhelpsdocs.com. That's Galen helpsdocs.com. Read up more about it and book a free call where you and I will talk and see if you're a good fit for fee-based planning. And now on with the show. All right, welcome everyone to this episode of a Clean Bill of Wealth podcast. I'm joined by Dr. Randy Cook. Thanks so much for being on my show.
And thanks so much for inviting me. I'm really looking forward to this.
Yeah, me too. Absolutely. And for anyone who doesn't know, Dr. Randy Cook has more than 4 decades of bedside practice as a general and a vascular surgeon. And he's a well-respected clinician, educator, organizational leader, and executive physician coach. And Dr. Cook is the host of the podcast Prescription for Success, which has a lot of really great reviews on Apple, which is fantastic. And that is a podcast that spotlights physician leaders reflecting on the elements that made them successful. So very happy to have you and very happy to see what we come up with in conversation.
Looking forward to it.
And so one of the things I'd love to hear about is, very fascinated by the conversations that, physicians are having with other physicians in the area of success and coaching. So if you could share with us a little bit your background of, what is it, what kinds of conversations are you having with physicians on that podcast? And what kind of conversations are you having around coaching?
Well, just to underscore the what we thought would be a good place to start a podcast, MD Coaches, of course, is a business that's dedicated to providing coaching services for physicians as well as other healthcare professionals. And the podcast, Prescription for Success podcast, was created as sort of a publicity vehicle for the coaching company as well. And we thought if we're going to be coaching physicians, if we're going to be talking to physicians about challenges that they're having in their career or decisions that they're trying to make about their career, it made a lot of sense to have some conversations with physicians who have already proven themselves as profoundly successful in many different ways. And that's exactly what we did. So every week, we get on a connection similar to this, and I have a conversation almost always with a physician. It's not always a physician. We have nurses. We even have some people who are involved in healthcare economics in one way or another, but it's mostly physicians. Mm-hmm. And we literally talk to them about their career from the inception, when they first thought they might be interested in medical school and what the training was like. And we get into much more detail about what it's been like for them as a physician. And it just, it gives us a place where we hope that people will hear what some other people have been through, and some of them have been through some incredible struggles. So part of the idea is that it doesn't necessarily have to be a chip shot. A lot of people think that everybody that goes to medical school is really smart and they don't have any reason to stumble and fall, but that is certainly not the case. So we talk about those things, and we also talk about the incredible diversity of things that people do not only in the clinical world, but in the non-clinical world as well. So that's a lengthy and rather non-detailed description of the podcast.
I got it. And I do find it fascinating to hear. And I mean, kind of like what you said of um, for some people, it may seem that physicians have it all figured out. They go to med school, they go to residency, they start practice. Usually they make a good income. Like life is good. And what I know as a financial planner of physicians is not is certainly on the money side. Not everything is always good, but also in other areas of life. And I mean, one fascinating thing is so my dad's a physician. He's retired now, but he's a nephrologist. Had a dialysis practice for many years, actually in Georgia, close to where you're at right now, and
that is close.
yeah, it's one of the things I didn't mention when we kicked off the podcast is that you are not in the same province or even country as I am.
That's a fact.
And I asked my dad not too long. Well, when I became a financial advisor, I asked my dad a little bit more about what he would have liked to have had on that end earlier on. But then I asked him one time how do you think I can support physicians more? And he said, introduce them to good coaches. Because he had a coaching experience a little bit late in his career, but it was a very profound one that helped him overcome a lot of negative experiences in his life. And so I find that interesting to really kind of.
I may be a little prejudiced, but I think your dad was right on, and I suspect that he probably is pretty near my age group, and he has seen the change in circumstances that has put today's clinician and a set of circumstances that didn't exist when your dad and I started our practices.
Interesting. What would some of those things be that you think that have really shifted?
Well, first of all, I think it's very important to understand that I suspect that most, I'm not going to say all, because every physician you meet is going to be an individual, but a great many people who decide to go into the practice of medicine are, they're overachievers, first of all. And secondly, they're almost pathologically empathic. They are there because they really have a significant capacity to see not only the physical pain in their patients, but also the emotional pain as well. And that is kind of a setup for self-destruction unless you're very careful. Also, I think the great majority of physicians, when they start their practice, are rather financially impaired, if I can use that term. And I have a feeling that you understand exactly what I mean in that regard, because they're not educated in assets, liabilities, and profit and loss and those kind of things. And they get lost in that world. It becomes very, very important, certainly if you're in private practice. But interestingly, I don't think that's gotten any better as private practice has begun to disappear, particularly in this country. And I don't really have a good feel for how it's going in Canada, but actually I think it's very similar north of the border. And as that shift has taken place, physicians are getting the feeling that they are looked upon as being expendable. They are looked upon as at best a profit center and at worst overhead. And to come face to face with that reality of somebody seeing you in that light is very upsetting. The other thing is some people get into medicine and they rightfully recognize right away that it doesn't feel like the right fit for them, and they don't really belong in clinical practice. So and this is getting to be a very complicated answer to your question, but what I'm seeing are two rather large groups. one group is those physicians who are uh, uh, profoundly dedicated to being good doctors, being good physicians, and delivering health care, and finding it difficult to do that because the people that they're working for are no longer the patients. They are some company or some insurance company or whatever. So they stand to benefit from coaching. And then the second group is those people who simply got into this field of endeavor and they just feel like they don't belong. And they're looking for something to do elsewhere. Or maybe they just want to do something in addition to. They're fine with clinical practice, but they want to add something else. And to be able to connect with an absolutely objective listener and talk those things out is profoundly valuable. And that's where coaching comes in. And that's why I think that organizations such as ours is a very good service.
Mm-hmm. Yeah, no, so much there to unpack. And I mean, certainly that idea of having an unbiased listener that you can speak to without fear of any sort of repercussions, because I find that physicians sometimes it's hard to express. I mean, like, oh my gosh, what will people do if they find out that I'm disillusioned as a physician, or if I'm trying to leave practice to go do something else? Yeah. Or even their own spouses or family, to hear that might be completely shocked and unable.
There's a profound amount of guilt associated with that.
Yeah, you worked so hard to get here, all that. Are you abandoning people? Are you abandoning your patients? And one of the things you said that I found very interesting, so it brought me back to, I did interview my own dad for my podcast a couple of years
did you
back.
really?
Yeah, and it was a Christmas special because he's a professional Santa Claus now. He's retired from nephrology. And he's a professional Santa. He's the Santa Claus for Bryant Park in New York City now.
No kidding.
Yeah. And so he talked about how a lot of times in medicine, he didn't feel like he had much of a creative outlet. He felt like it was very restrictive what he was allowed to do. And I mean, even if you go down the road of what are doctors allowed to do outside of their practice that can not be seen as a conflict of interest, all that. So he told me how he found creative outlets, and he found his own way. But certainly I'm seeing more and more physicians turn to something like whatever it is, creating podcasts or coaching, or like there's a lot of things that I see physicians taking on. And I think it is part of that, as you mentioned, high achiever. I had a podcast episode recently where we're talking about high achievers, and the person I was interviewing joked that a lot of high achievers don't even notice that they're high achievers, but they are. So a lot of people might listen to this and say, I'm not a high achiever, but if they're a doctor, you're a high achiever. That's just about all there is to that. Yeah. So I hear the power of coaching when someone's in this sort of this sphere of either not completely happy with what's happening with them, or looking to make a change within the practice or outside, and the value of having a coach.
That cognitive dissonance of these thoughts and beliefs and attitudes that you've been feeling for years and years, and you sort of look in the mirror one day and all of a sudden it doesn't match with reality. That's the time when you really need to talk to somebody. And ideally, we think that the best somebody to talk to is somebody who has absolutely no judgment, who will be completely honest with you. And that's what we do.
Yeah. And I think my dad would be okay with me saying this, but he's described it to me that he reached a time in his life where he felt like he was living a life of quiet desperation and couldn't really say anything about it.
Yeah, I understand that precisely, and I try not to get too personal in these conversations, but I went through exactly that. I reached a point where I thought it was probably better if I stopped operating, if I stopped doing surgery. And interestingly, there's actually some conversation going on right now about whether or not there ought to be a mandatory retirement age for surgeons, which I think that's going to be an interesting conversation. But in any case, as I was about to say, I really didn't want to stop practicing, but I thought it was best that I stopped doing surgery, particularly the huge complicated cases that I had been doing for 44 years. And so I took over the management of a wound care and hyperbaric medicine center for my hospital. And it was profoundly gratifying. I liked seeing the same patients week after week, month after month, because these people with chronic wounds, they don't heal up quickly and disappear. Whereas, in my surgical practice, I would operate on a patient. We'd get them home from the hospital. They would see me maybe twice in the office, and they disappeared. But these patients I was seeing for a long, long time, and it was just I can't even begin to tell you what a gratifying experience it was. But again, there was that shift. I was no longer absolutely my own boss. I was supposed to be the wound care. I was supposed to be the medical director of this wound care center, but the wound care center belonged to the hospital, and they had a different way of evaluating our performance than the physicians and the nurses did. And I and I'm sure that was when I stepped into that sort of netherworld that your dad was talking about. And even though I was doing the best that I could with every single patient that I touched, it was just an absolute ongoing battle day in and day out to get my overseers to support me in what I was doing. And that is soul crushing.
Yeah. No, I'm hearing that. Well, first off, that shift sounds fairly interesting, from surgeon to more of that patient facing work, and then also like doing your best but not getting that support, and how difficult that can be. And I mean, one of the reasons I like working with physicians is they tend to. It was kind of like what you said. I mean, yes, the high achieving side, but they tend to be great people. Like I like my clients because I like to work with people I like hanging out with.
Sure.
And I like hanging out with my clients. Like it doesn't have to be all formal and everything. And one of the things you said though, it's kind of funny. So years ago when I lived in Venezuela for 10 years. And at one point in time, a group of physicians came down to do cleft lip and cleft palate surgeries, because there was a higher percentage of children with that issue than maybe in more developed countries.
Right.
And they came down, and some of these kids were 7, 8, 9, 10. I mean, they worked on adults even sometimes that had this their whole lives. And I joked with my wife, my girlfriend at the time, but wife now, I said, surgeons must not like patients very much because they've chosen a specialty where they don't spend a lot of time with them while they're awake. Because we would, them, especially, and there was a language barrier. The reason I was there was to translate. I was there as a translator. Basically the patient would come in asleep, the doctor would do the surgery, and they'd wheel them out before they woke up. Because this was also a very quick thing that they were doing, like multiple surgeries a day. And a lot of the surgeons obviously would come out and speak with the patient after the case and talk to the family and all that. But I did notice that disparity of not spending a whole lot of time with the patient while they're awake and spending a lot of time with them while they're asleep.
I think surgeons get a little bit of a bad rap because it's easy to give that impression. But believe me, we have to admit that there are surgeons like that. They are expert technicians, and the reward for them is a perfect operation. But I think the majority of us really do like developing that connection with patients. Most of the people that I've worked with during my career certainly do. They can tell you all kinds of stories about the connections that they've made and the things that really make sense, that sort of underscore the reality that they do like the human connection. But just because of the way the specialty is practiced, it makes it a little bit difficult to make that entirely clear.
Absolutely.
The patient comes into the operating room so drowsy they don't even know who you are, and you do an operation, and get them into the recovery room. They're fine. You go and talk to the family, but you can't really sit and spend an hour with them
No.
because the operating room people want you back in there
Yeah. Got to
for
get
your
back in
next
there.
case. So it's a different kind of world that can get in the way of your need to get closer to the patient. But I think most of us try to do that.
Mm-hmm. Yeah. Well, I just thought I'd have that as a bit of an aside because that was what I was actually pre-med for a little while. And then I went to I worked at Bellevue Hospital in New York City for a summer as part of an intern program they had. And most of the kids there knew they wanted to be doctors. And this was something to pad their resume, so to speak, or their portfolio. I was there to really figure out whether I wanted to do this or not. And I ended up deciding not to. Um,
Mm-hmm.
but I definitely got a good feel for all the different specialties and what their lives looked like and what their patient interaction looked like. It was a
I
very
bet you
fascinating.
did.
Yeah, it was very fast. And when I did the translating down in Venezuela, that was interesting too. But up in Bellevue Hospital, we did different rotations in different areas to get a feel for everything that was going on. And yeah, at the end of it, I really wanted to be a ambulance, an ER ambulance driver, not paramedic, but what's EMT.
Yeah.
I thought they had the most fascinating job because this was New York City, and I was like,
Maybe they do.
I was 19, and we were driving the wrong way down New York City streets, one-way streets with the sirens blaring, trying to get,
Yeah.
we'd go to one thing which was like someone who was, dizziness in a high-rise office building, and then the next one was in a low-income area, someone dealing with chest pain. The next one was, it was just the variety of things
Right.
they saw was just mind-blowing, and
They see all that life has to offer.
yeah,
They really do.
So I walked out of there thinking, if I become anything, I'm becoming an EMT because it was just fascinating. Whereas I met surgeons who said, I met a surgeon who said a monkey could do my job because he said, I just do the same thing day in. And he didn't really, really mean it. But he did say that he said, I get to a point where you just feel like you're doing the same thing over and over and over again.
And unfortunately, that has become more of a reality, I think, as the science of surgery has matured. If you were there has become a specialty for just about every organ system that you can name, and I can understand how in this day and age that it's easy to feel that way. When I finished my surgery training, I was a general surgeon, and I pretty much did it all. Now, neurosurgery had been isolated by that point in time, as had orthopedics. But I did hernias, I did gallbladders, vein strippings, which we did back in those days, and I also did vascular surgery. I also did cancer surgery, and it was a great way to make a living.
A lot of variety.
You bet.
Very interesting. Very interesting. And so I'd love to get to dive into the coaching side of things a bit more.
All right.
So what kinds of, so we've talked a little bit, like the ability to provide a physician with a unbiased ear where they can just say whatever they need to say and not have to worry about any repercussions or any sort of,
Right.
judgment. What kinds of things do you see people coming to the table, physicians coming to the table with, of things that they're dealing with behind closed doors that they really need some coaching around?
Well, it's basically those two things. I became a physician because I wanted to feel like I was making a difference, and they don't necessarily use these words, but they wanted to be able to feed their empathic spirit. And then the other large group is those people who have either practiced for a long time and feel like they've got more to offer, but they would prefer to do it in a non-clinical setting and they want to get out of clinical medicine. And then the subtype of that are the people that get into medicine and find that it's just not right for them. And they want to make a change. So I think those are probably the two big categories. And with respect to the ones who want to remain in medicine, I find them to be the more challenging, the more complex. Um, I think probably in many cases uh, that feeling begins to wash over them because the job that they're doing is just simply not giving them the uh, uh, personal reward that they expected that it would. Um, and in most cases, it will be related to this nebulous thing that we call burnout, which is another thing that I think is a very difficult subject to talk about. We don't have a good definition for burnout. Um, it's one of those things. I know it when I see it, but I don't know how to describe it and that kind of thing. But I see that, and just about everybody that comes up and says, I'm not getting the personal reward from this that I thought I was going to get. And I could be wrong, but I don't think so. I'm going to go out on a limb and tell you that, it's 2021. I started my medical training in 1971. So I've been at this for literally a half century. It was different 50 years ago, and the pace of change picked up. But there has been an evolution through which physicians have had every reason to feel like hardly anyone sees their value. They can be replaced by a nurse practitioner, perhaps, or we're going to sell our group to the hospital, and the hospital doesn't need as many of these specialists, whatever the case might be. But rather than feeling like they are actually doing a job, providing a service for a patient, they feel like an employee. And it's very difficult for them to make that meaningful, empathic connection in those circumstances. And those are the people that I think can benefit by being coached into leadership positions. As we talked about in our opening a few minutes ago, the need to take control of circumstances and restore the patient-physician connection to what it was back when I started, for example. If it can be accomplished, I think it will go a long way toward wiping out this thing that we call burnout. But in order to do that, physicians have to take much more control of the healthcare delivery environment. And unless you are someone who understands the business world, knows how to negotiate with people whose ideas don't necessarily align with yours, and have an influence on people who see physicians more as overhead than as healers, you're going to have a very hard time with it. So one of the things that we can do at MD Coaches is to help people find ways to develop those executive skills that can enable you to function in that environment, to help take control of the physician experience, because it's just not something that comes naturally to physicians. So the opportunity for us to help people work on their leadership skills and give them an opportunity to step out there and take control of their work environment, I think, is a really it's a big plus for us. We get a lot of gratification for helping people sort of restore themselves to a point where they feel like they actually are making a difference in their own environment. And then, as we said before, there are people who just feel like they don't belong. They don't want to do clinical medicine anymore. And again, the development of these executive skills to apply to your effort to function in a non-clinical role is also very important. So those are broad generalities. But if you're a good coach, you're going to let your client tell you what they need. And you're going to do way more listening than you do instructing.
Absolutely.
And what we find is that when an individual is given that opportunity, particularly someone who is as intelligent and as motivated as most physicians are, they will start to put the pieces together. And once that starts, how can you not succeed?
Yeah. No, I got it. Yeah, no, definitely talking about, that the burnout and the difference between the way that things were practiced decades ago versus now. And I was on had a episode recently where we were talking about the arrival fallacy, which the physician's experience is set up to almost like they're always waiting for the next thing. Like, like a lot of the people I was in this program in New York City were already pre-med. And they said, okay, then I'm going to do pre-med, then I'm going to go to med school, then I'm going to do residency, then I'm going to do fellowship, then I'm like this whole list of things, and then I'm going to be at this spot. And then I think it's the human experience to think, oh, once I get to this spot, then I will be content or happy.
That's exactly right.
And I feel like the physician experience amplifies that, because it's so much waiting. Like, now that I'm practicing, maybe by the time I pay off my debt, now I'll be, it's like all these things that keep like encouraging this arrival fallacy of one day I'll be happy or content, and you can wait forever.
You're exactly right about that. And I think one of the things that we can do as coaches is to help physicians refocus on what really makes a difference to them. You're exactly right. When you get distracted by focusing on making your student loans go away and getting into the house and the neighborhood that you want to be in and so forth and so on, that wheel just never stops turning. But if we can find a way to help people focus on the incredible self-satisfaction of being a physician, of being there for a person who is in need, and experiencing the gratitude that comes from the patient because of that, all of those other things begin to take on a different perspective. It's not that those challenges are not out there. We all have to pay our bills and get our kids through school and all of those sorts of things. But if you can go to work and reach the end of your day and feel like you made a difference, that just makes everything a lot easier to deal with. And it gives you a much better perspective on what's really important in your life. And the tragic thing that I see today is that it's getting harder and harder for physicians to really have that experience. And again, I think the key to that, the answer to that, is simply that physicians need to regain the influence that they had when I started, for example. In those days, a long time ago, there was always some component of the medical staff in every hospital that spoke for the physicians, and administrative people never even considered invading that space. But it simply doesn't happen that way anymore. We're working with nurse-to-patient ratios that are worse than they've ever been. I don't think physicians would have ever let that happen if they had a proper voice, and the list goes on and on. But again, in order to have success with that, you got to have a seat at the table, and to have a seat at the table, you're going to have to be taken seriously, and you got to learn some executive skills, and those are the kind of things that we can help with.
That's amazing. That's great. No, I love the breadth of experience you've had. I see how you have a lot of insight into this progression and this evolution, and then the different skill sets that are necessary to bring about change, which is very, very cool. As we wrap up the conversation, I just want to make sure everyone knows exactly how to find out more about what you guys are up to over with MD Coaches. So if you let us know, is there a best place to check you out? I imagine that go ahead. Was there a best place to find you online?
Well, I think the easy way to do it is to go to the MD Coaches website, which is mymdcoaches.com. That's mymdcoaches.com. And once you're there, you can find links, obviously, to everything that we do. There's a link to the podcast in there. But if someone wanted to go directly to my podcast, which would make me very happy, by the way, it's called Prescription for Success, and you can find it on all the podcast platforms. But the podcast website is rx4successpodcast.com. And if you put that in the browser, it'll take you right to the podcast website. But again, probably the easiest way to do it is to go through the MD Coaches website. I'm happy to get anybody's email. And my email address is Randall with 2 L's, randall.cook@mymdcoaches.com.
That's great. Yeah. So people can reach out directly to you if they have any questions. And then
you bet.
Be sure to check out mymdcoaches.com, where you'll see links to the different, you see all the different resources that are available, including the Prescription for Success podcast. That's fantastic. Well, thank you so much, Dr. Cook, for joining me today. Definitely gave me a lot of insight into what you're up to, the power of coaching with physicians. So I was happy to have the conversation.
It's been a lot of fun. I can't tell you how astounded I was to find out that you were originally a Georgia boy. This was
That's right.
Surprise.
Born in Rome, Georgia, just outside of Atlanta. Not a lot of people not a lot of people know that. But yeah, I've moved around a few times since then. But that's right. I grew up outside of Atlanta in a small town called Rome, Georgia. Yeah.
I'm very familiar with Rome. It's right on the Alabama-Georgia border, at least close to, I guess.
Yeah, so I was born at Floyd General Hospital. And that's where my dad had his nephrology practice in Rome, Georgia. That's where he was working a while back. It was back in the 80s, I think, when he had his private practice in dialysis. Awesome. Well, so great talking to you.
Same here. Enjoyed it.
Thanks. Thanks so much for having joined me on this episode of the Clean Bill of Wealth podcast. I truly appreciate you taking the time to do so. It really warms my heart to see the numbers of people listen to each episode go up. It's just a lot of fun. Feel free to scroll through the other episodes. I've interviewed a lot of really amazing people and just want to get their insights out there to Canadian physicians. If you're left wondering anything about your financial plan, whether you're making the most of your corporation, are you on track for retirement, are there more efficiencies you could be finding, feel free to head on over to GalenHelpsDocs.com. That's GALEN helpsdocs.com. You can read more about the work I do, my offer of fee-based planning, which is pretty popular among medical professionals, where you pay for a plan, you don't have to buy a product. Go over there, click a button, book a free call. We'll have a quick conversation and see if you're a good fit for the fee-based services. All right. Thanks so much for joining me. Take care.